Hey, good afternoon. Welcome to the Providence Holy Cross Health Hour. This is Tom Burton, the Orthopedic Program Manager with Holy Cross, and come to you live from the Newhall Station. And it is a stunner of a day out there. Probably getting some of the best days we possibly can before the rain starts to come back. It's as a Providence employee with Holy Cross, you kind of wonder what in the world are they doing out here in Santa Clarita. And, in talking with all of the staff over at the hospital, 30% of us who work there are actually living up here. At least 30% of our patients are who are utilizing the Holy Cross as a hospital are coming from Santa Clarita, and that is only growing as Providence continues to grow, as our counterpart, Facey, continues to grow. We are carrying a very large footprint, not only in the San Fernando Valley, but extending adjacently into the Santa Clarita Valley, and glad to be able to do it and be able to offer up the care. As a 377-bed hospital, acute care hospital with trauma center, we are the place of choice. And for talking, if you've been following the show over the last year or so, you probably realize that there really isn't much that we can't take care of, which is great. And all of a sudden, here we are, we're coming up within a week of something extremely exciting. And I'm really happy that I get a chance to bring it out during our talk today, and it also kind of stemmed why we're going to have our guests today as well, and also in the month of April when we get to revisit. But coming up on the 25th, now I want you guys to mark your calendar on the 25th, from 8 till 3:30 over at the Santa Clarita Performing Arts Center, which is located on the College of the Canyons campus. We're going to have the very first inaugural Cancer Awareness and Resource Expo. Now, this is important, all right, because cancer is becoming much more prevalent, and we are finding more and more that the earlier intervention, the better off the chances of quality of life and successful outcomes, and that this is so important that I am fine with mentioning that Providence Holy Cross will be doing this with Henry Mayo. There will be a number of people that are going to be available at this tremendous expo. Let me just kind of share with you, if it will. We're going to be starting up around 8 a.m. We're going to be talking about prevention and early detection, treatments, breakthroughs. We've got an expert panel of physicians and staff that will be doing a Q&A to be able to handle whatever questions you might have. There's going to be resource and support information. There's going to be booths, on-site health screening. City of Hope will be there with their blood mobile taking blood donations for those who have the availability to do so. And it's free. The only thing we ask is just go to carescv.com. That's carescv.com and register, and they'll have all the details regarding the event. We want to know that you're going to be coming. Just kind of give you an impression of who will be our keynote speakers. Dr. Renee Callahan from UCLA, go UCLA. One of our RDNs, Sharon Palmer, Dr. Chu from the City of Hope, who will be one of our guests in April. Very exciting to hear that. We've got Terry Bucknall from the Sheila Vilos Breast Center. Dr. Nancy Ellerbrook, who I've had the opportunity to work with as a physical therapist, taking care of some of her patients who are status post surgery for cancer removal and in preparation of going through their radiation. Dr. Fekrazad from the City of Hope as well. We've got staff from Holy Cross. We have staff from City of Hope. We have staff from Henry Mayo. It is going to be a very, very big expo on something that is so extremely important. And I can't impress upon everyone enough that the early intervention is going to be the really big deal, and then prevention. And in fact, it's part of what their little moniker is: prevent, treat, and survive. And we really hope that we get a chance to see everybody there. Again, it's February 25th. It's going to be from 8 till 3:30 at the Santa Clarita Performing Arts Center on the campus of College of the Canyons. And we appreciate College of the Canyons being there for us to be able to have this. And again, on a topic that is important, we're going to lay any competitive nature aside. Holy Cross and Henry Mayo will be there together. To see what we can do to improve upon people's life, make people more aware of cancer, and be able to move forward from there. just an example of some of the booths that are going to be available and some of the resources that are going to be available. I had mentioned that Providence Holy Cross, of course, will be there because we do support our community, as will Henry Mayo Hospital. The Sheila Vilas Breast Center is going to be there. City of Hope. If you haven't been driving around, you're going to realize they're sitting right smack in the middle of Valencia, and just very proud to say, and I think you heard it when our CEO from Holy Cross, Bernie Klein, was on a bunch of months back. City of Hope is a community partner with Providence Health System, specifically with Holy Cross, and I believe also Tarzana. Is that right? I think. I'm going to get a nod, perhaps. I think I got a nod. Santa Clarita Radiation Therapy Center, UCLA Health is going to be there. Go UCLA for different Pac-12 reasons. Kaiser. At this time, on something so important, we're going to lay our differences aside and we're going to come together as a group to support the community. All of the health facilities, all of the different health groups and such. American Cancer Society is going to be there. Michael Hoffman Foundation, Bosom Buddies, Leukemia Lymphoma Society. There is just lists and lists of who will be there with booths, activities, screenings, you name it. So please make a point, come out, listen to what our experts have to say, and let's see if we can't glean some great information from this. Here we are in February. We've got ourselves an absolutely stunning day. Listening here on KHTS AM 1220, your hometown station. Please be sure, too, for those of you who are traveling in and out of the valley, make sure you get your KHTS app. You can get it for your Android, you can get it for your iPhone. This way you have the ability to not lose the signal as you're driving out of the valley into the San Fernando Valley or heading up into the Antelope Valley. And it'll give you the opportunity to be able to listen wherever you're at, anywhere in the world. Do recommend getting it. I put it on mine. I actually listen to it at work. Anytime I have the opportunity to, away from patient care, please make sure that you get that app, and that's going to make it a lot easier. And what it's going to really make it easy, I've got two amazing people who are joining us today here in the studio, and we're going to go one by one. But let me just kind of go over the very first one, and I'll kind of do an introduction, and then we'll welcome in Ms. Vivian Gonzalez, family nurse practitioner with an advanced oncology certified nurse practitioner. So, we're talking some serious stuff here. She is the oncology program nurse practitioner for Providence Holy Cross. And, something that's near and dear to me, an undergrad from UCLA, go Bruins, and a graduate from Azusa Pacific, where she received her family nurse practitioner training. And we're lucky enough that she came to us back in April of last year to join us over at Holy Cross after a nice time over at City of Hope, where, again, our community partner is City of Hope with Holy Cross. And the nice part of it is that she is, as the navigator, she is working hands-on with the patients. And I think probably one of the nice parts of it is that as an employee of Holy Cross, you're not bound to a specific medical group. You're there for the patient on behalf of Holy Cross in order to be able to make sure that you're taking care of everybody. So, hi, Vivian.
Hi. Thank you for having me on.
Glad to have you on. Now, tell me, it's always interesting because I always want to find out how people do make the decision on the direction they're going to go. What drove you to be a nurse practitioner?
In oncology specifically, as a child, I would read books about patients, young children wanting to have their last wish when they were diagnosed with leukemia, etc. When I went into high school, that was the direction that I knew that I wanted to follow, oncology patients. So I did a program at Stanford, and there they put me in the oncology unit, and there is where I met a young boy who was playing Nintendo games, bald, and was undergoing treatment. And just his welcome, how courageous he was as a child, made me empathetic, want to work with cancer patients. So went to UCLA and decided to pursue my degree as a nurse practitioner. My first job out of nurse practitioner school was a hematology oncology clinic. And I remembered back to my roots of why I wanted to be a nurse or nurse practitioner. And so I have been in this field for about 7 years, and I love every minute of it.
That's fantastic. And you are working directly with patients.
Correct.
Correct. And now Now you're getting the opportunity to be introduced or to be in working with patients once they've actually been admitted to the hospital. So maybe step me through as the navigator, what does that day look like?
So I do see newly diagnosed patients on the oncology floor. We have a wonderful 20 bed floor in Providence, Holy Cross, and Mission Hills. And I can see newly diagnosed patients that are either post-op, so it could be a simple mastectomy, newly diagnosed breast cancer, or someone that came into the ER with some vague symptoms and end up being diagnosed with cancer in the hospital. So as you can imagine, that is very difficult for a patient. So I come in and introduce myself as oncology navigator and as an unbiased party to be able to walk them through this new diagnosis for them and throughout the continuum of care. So after I see them, I'm a point of contact for them, and I will call them after their hospitalization and make sure that they're on the right track for their care.
Education and resource, obviously, then, especially with the new diagnoses,
Yes.
it's like huge.
Correct.
Right. So with that role, you will work them, keep them all the way through inpatient, and then you do get a chance to do a little outpatient follow-up.
Absolutely. So I do a survivorship care plan with them. So if they're going to end up doing radiation or chemotherapy, I'm a point of contact to educate them on anything that they may have heard in their first visit with an oncologist but might have went out their ear. So I reinforce the education with them, and then also provide them a care plan that they can take with them throughout the rest of their lives of what this time frame, this cancer plan was for them to share with their primary care doctors, et cetera. And it gives them education on general wellness, health screening, things like that.
Right. And it also sets expectation too.
Correct.
Right. And that seems to be very, very helpful with patients. And I just want to let everyone know that we are, as a hospital, we are graded based off of our patients' experiences. Mm-hmm. And, at the wings that I oversee, which is the medical surgical wing that we do our independent care rounds for, we're number 2 in patient satisfaction.
Right.
And we can't get close to the patient satisfaction that the oncology floor has. You guys are doing such an amazing job, and for people to be able to fill out a survey and express them in some cases probably the hardest time of their life, to be able to give you guys such a glowing report is a huge credit to the work that you guys are doing. Mm-hmm. Between the nurses, the communication with the physicians, with the navigator, right. Case management, discharge planning, everything. So it's astounding to have to have you here actually, because you set a bar that I would probably say that it's almost unreachable. Because of the efforts that you guys have been able to do, and I know that the instances that you have done and the examples that you are setting is now going through the rest of the hospital. So thank you very much for that. And now, part of your role, as you mentioned off air, we were kind of talking about it, was you were introduced into the lung cancer screening program, mm-hmm. and you kind of have adopted that as part of your programs that you're going to be overseeing and working with. Can you tell me a little bit about it?
Yeah, so we are very proud here at Providence to introduce our lung cancer screening program, which was recently designated by the American College of Radiology and recognized as a Lung Cancer Alliance National Center of Excellence for having a comprehensive lung cancer screening program. So basically, we encourage smokers or people that have a history of 30-pack years or more to get a low-dose CT scan. And the reason why a huge national study back in 2011 showed that a low-dose CT scan can reduce lung cancer mortality by 20%. And this is a big deal for lung cancer because lung cancer is actually the leading cause of cancer-related deaths.
Right.
The benefit of screening smokers is that we find that you can catch cancers in their early stage when they're most treatable. So they can have it surgically resected. More than 50% of patients now, smokers now, are diagnosed at a later stage of having lung cancer. So this lung cancer screening program is very important for our community to be able to catch lung cancers at an early stage and decrease mortality for patients.
And those early stages will most likely not have symptoms. And I think that's probably one of the biggest issues is that in the early form, cancer really doesn't offer any symptoms. And so it's not until you become symptomatic that, or
Correct.
you start having other medical issues and it's haphazardly, I guess,
Right.
discovered through diagnostics that otherwise you weren't looking for that.
Correct.
And that's kind of the hard part of it. But we do find that early intervention can treat, and we can
Correct.
have good outcomes with treating.
Right.
Now you mentioned 30 pack years. Okay, now I didn't realize there was a measure, and when I first saw that, and thankfully on the brochure it actually designated what that was. And basically, it's 1 pack a day for 30 years.
Correct.
Okay,
Or
so
if you,
on average.
Right. Or if you smoke 2 packs a day for 15 years, you would still qualify for the lung cancer screening.
Okay, so basically for this program specifically, we're looking towards smokers because we know that is a demographic. That is a population that is definitely going to be having issues with lung cancer, or potentially have issues with lung cancer. That we want to invite them in. For those who have been smoking for a prolonged period of time and have been smoking a lot, that we want to do these tests. And it's a low dose CT scan, right? It's not going to be it's not the normal amount of radiation that would normally occur with a CAT scan, that they can do it with much less radiation, which is going to be much safer
Correct.
for the patient.
Right. 1/8 of the dose of a regular CT scan.
And that's going to be enough that we'll be able to get a good image to make a determination on the general health of the person's lungs.
Correct. According to the national study, compared to regular chest X-ray, the CT scan was able to capture small lung cancers.
Now, with that, then comes the next piece. So now you have people who have a long history of smoking. There's cessation programs that obviously we should be addressing too.
Correct. Now, tobacco is the most preventable cause of death in our society. Not everybody that has lung cancer it was a smoker, but we realize that smoking causes 70 to 80% of lung cancer deaths. So tobacco is stopping tobacco is a very important thing to help your overall health for cardiac risks, for COPD, emphysema. There's so many different other cancers, not only lung cancers, that tobacco affects your overall health. So we do refer to the California Quit line. It's 1-800-NO-BUTTS to help our patients stop smoking, and counseling, behavioral counseling, things like that for our patients that wish to stop smoking.
I think that's important. Is again, prevention is usually the best direction to be able to go when it comes to this, and that trying to take away all of those different types of irritants that we could be putting into ourselves so that we can actually be healthier is going to be a really big deal. Right. Well, I mean, you're listening to Vivian Gonzalez on the Providence Health Hour right now on KHTS AM 1220, your hometown station. Now we're going to be moving on to talk about talk about a deep dive. We're going to be going into genetics coming up after the break with our next guest, and I'm going to hook that one there, and we'll introduce Monica. I want to let it out when we come back from commercial. So we'll see you in just a moment here on KHTS AM 1220.